Welcome to the Ministry of Health Week in Review, where we highlight key events from the past week. On October 14th, a team from Vector Control Services met with Minister of Health Dr. Frank Anthony to discuss the malaria surveillance capacity assessment and the progress of the National Malaria Strategic Plan for 2026 to 2030. The minister underscored the ministry's commitment to malaria elimination. He stated that while radical change takes time, the necessary tools and expertise will already be in place to make significant strides towards this goal. Later that day, the health minister attended the event held to commemorate Allied Health Professional Day 2024. With this year's theme, Quality and Safety, the event focused on strengthening partnership to ensure high standards across all healthcare professions. During his remarks, Minister Dr. Frank Anthony emphasized the essential role of allied health professionals such as lab technicians, radiographers, and physiotherapists, opticians played in delivering quality healthcare to patients. Meanwhile, the Chief Medical Officer, Dr. Narain, commended the Council for being particularly active in ensuring that these professionals meet high standards both in public and private sectors. On October 15th, Dr. Anthony participated in a digital health workshop hosted by the Tony Blair Institute. This event held to gather input from stakeholders as part of a broader effort to develop a comprehensive digital health strategy for Guyana. Later that day, the Ministry of Health convened a concept design workshop for the upcoming construction of the New Amsterdam General Hospital. This state-of-the-art facility will include 5 operating theaters, one of which will be dedicated to cardiac surgeries. It will also feature 24-hour accident and emergency services and advanced medical equipment, including digital X-rays and CT scanners. Minister Dr. Frank Anthony was present to contribute to the discussion on the design and layout of the hospital, which is expected to significantly enhance healthcare delivery in Region 6. On October 16th, the Ministry's Vector Control Services hosted a stakeholders consultation meeting to discuss the development of the National Malaria Program Strategic Plan for 2026 to 2030. During his keynote address, Minister Dr. Frank Anthony emphasized the importance of exploring new strategies and focusing efforts on malaria elimination, particularly in areas where the disease remains endemic. On the said day, the Food Policy Department of the Ministry held its second consultation meeting to revise and update the Anemia Policy 2024. The goal is to finalize this policy by the end of the year to better plan interventions targeting iron deficiency in the population. That wraps up this week's review. As always, we encourage you to take advantage of the Ministry's health program, including ongoing eye testing and spectacle voucher program. Remember, eye testing vouchers valued at 2,000 Guyana dollars are available for senior citizens 65 and above and children 18 and under, with an additional voucher for spectacles valued at 15,000 Guyana dollars. All eligible persons are encouraged to utilize their eye testing, spectacle, and cervical cancer screening vouchers by November 30th, 2024. This is done to enable timely processing of individual transactions and payments to service providers before the end of the government's 2024 financial year.